views expressed on this program are not necessarily those of WTJX, its board, staff, or underwriters.
Good day and welcome to Ability Radio. I am your host, Angus Drago. This is a show that's, if you're joining us for the first time, that is, a show that's hosted by the Disability Rights Center of the Virgin Islands. We provide legal advocacy for individuals with disability. We have two offices, one in St. Thomas in Havenside and one in St. Croix next to the old Kmart West. Our numbers 340-772-1200 and St. Thomas 776-4303. But you can call either number and get either of us. Today I'm happy to welcome Ms. Julia Sheen. She is the Executive Director, CEO of VI Diabetes Center of Excellence. And she's going to be talking to us a little bit about diabetes, some of the preventative things. I've listened to her on some outreach events that we've collaborated with her on. Mm-hmm. And she has a wealth of information about it. So just let Julia take a show up.
Thank you so much for having me. I really appreciate it, Angus. I wanted to start by talking a little bit about myself, just in case for people that don't know me. I'm Dr. Julia Sheen. I'm the Executive Director of the Virgin Islands Diabetes Center of Excellence. And I was actually raised here in the Virgin Islands. And diabetes is near and dear to my heart because I had a brother who was diagnosed with diabetes when he was about 15 years old. And he died from diabetes complications when he was 33. And my research, my academic studies, my master's and my doctorate was focused on diabetes. And I actually conducted original research in the Virgin Islands focusing on the barriers associated with uncontrolled diabetes among health center patients. And some of those barriers include things like culture, because, culture has everything to do with what we eat and the way we live. And, of course, medication management. So a lot of what we do in the Diabetes Center of Excellence focuses on addressing those barriers. And diabetes is really critical here in the Virgin Islands. I call it a silent epidemic because 18.6% of our population live with diabetes.
Wow.
And it's increasing every year. And that's data from the Behavioral Risk Factor Surveillance System survey. And that's 2024 data. In 2023, it was only 16.3%.
Wow.
So as you can see, the prevalence of diabetes continues to increase. It is the 7th leading cause of death. And we have a number of risk factors associated with that disease. Everything from us being a very overweight, obese population to 30% of our population having high blood pressure. And once you have high blood pressure, it predisposes you for diabetes. So what do we have to offer? First, a little bit about our mission. Our mission is to prevent diabetes and reduce its complications through health promotion, patient education, treatment, and research. And our goal is to reduce the burden of diabetes and improve the quality of life for everyone living with diabetes. And we have 4 strategies to doing that. The first is what we call our rural health outreach program, and we use our mobile van to go into the community to identify new cases of diabetes and those individuals who have uncontrolled diabetes. We just launched, in partnership with the Department of Education and the Benny Benjamin Foundation, a childhood diabetes prevention program. So we're going to all of the elementary schools across the territory and screening children in the 4th and 5th grade, as well as those children with family history and those that are overweight. And we started at the Eulalie Rivera School. And we went to Pearl B, and we will be going to Ricardo Richards on the 30th. So I'm really happy to have that partnership with Department of Education. And I'd like to thank Mary Moorhead and the Commissioner of Education for partnering, and Danelle Lang for assisting us in facilitating that partnership. We do a lot in terms of diabetes education. We offer a monthly nutrition an education class. It's a very popular class. It's free to the community. If you'd like to learn more about it, please call us at 340-208-0260. We offer a diabetes medication management class, and that's important because, as I mentioned earlier, medication management is also a barrier for persons living with diabetes. And what I'm finding, because we not only provide education, but we are providing diabetes treatment services. So we have a pediatric endocrinologist on board who sees both children and adults, and that's through a partnership with Howard University. We also have a podiatrist, Dr. Ava Roberts. Our goal really was to establish, and we've been able to accomplish that, a patient-centered medical home for people that have diabetes. And we're seeking certification for that as well. And we do have a partnership with Pleasant Ophthalmology, but our ophthalmologist is out of Johns Hopkins University. Yeah, so we screen our patients in office. We test for diabetes retinopathy, and then the Pleasant Ophthalmology follows up with those patients to provide any treatment for those persons that test positive. We have 2 registered dietitians, one who teaches the monthly nutrition class, and then one that works with our patients on an individual basis just to help them develop meal plans, because food is really tied to our ability to manage diabetes. So we offer both in-person and telemedicine services, and we will be ramping up our telemedicine services this year. We are bringing on Dr. Cecil Bennett. He is a board-certified primary care doctor. We're ramping up our chronic care management services and our remote patient monitoring program. So we do a lot for our patients with diabetes, and we're seeing that we are making a difference. 80% of our patients have demonstrated reductions in their A1Cs. So we're making a difference. We're not just seeing patients, but we are also getting the outcomes that's needed. Our patients are losing weight. I got a text just recently from one of our patients. She participated in our Prevent Type 2 Diabetes program. It's a year-long program where we work with people who have prediabetes to make sure that they don't move from the pre-diabetic phase to a diabetic phase. And she just texted me to say, when she started with us, she started at 192 pounds. She's 140 pounds today. And so she was thanking me for offering the program and just talking about how the program has benefited her and her family. So I would encourage you, if you have diabetes or if you're looking for a place to receive your primary care services, Vidco has the ability to do that. And especially with Dr. Bennett coming on, he is going to be doing a whole lot more to expand a lot of the services that we offer.
The classes that you spoke about, are those online or in person or hybrid?
Yes, so they're hybrid classes. So they're online, but you can come by our office. We're located in the Sime Farm Shopping Center and right next to the Frame Up. If you don't have access to the internet, you can come in, and we have state-of-the-art AV system in there that you can come and participate in the classes. And they're usually offered at 12 o'clock, from 12 to 1 o'clock.
12, okay.
Yes.
I'm happy that you're mentioning in terms of the statistics, because when I look in looking at some information for the show, they're saying that 20% of Americans 45 and older have diabetes, but they're unaware of their condition. So how, with the numbers in terms of the percentage you mentioned earlier increasing from 2023 on, 2 things. What do you think is responsible for the increase, and what can we do as individuals and as a government and other not-for-profits to stymie that growth in terms of the numbers?
Well, there are a few things. One of the things I found in my research is there's some sort of a myth associated, a stigma associated, lots of myths associated with having diabetes, but stigma. associated with it as well. There's some sort of shame that people experience when they have diabetes. They don't want people to know they have diabetes. And it's just interesting that they would feel that way because you can actually live a very fulfilling
life,
life.
yes.
Yeah. And you with diabetes. The challenge is you have to manage it before it becomes complicated, the complications set in, because there's so many complications, from death to stroke, heart attack, blindness, losing a limb. And I wanted to mention one more data fact. I met with a local surgeon recently, and he said that he performs 3 diabetes-related amputations on a monthly basis here on St. Croix. So that's very significant. So when we talk about prevention, you asked, what are some of the things that we could do to prevent diabetes? First of all, number 1, most people in the world, not just here in the Virgin Islands, have type 2 diabetes. That means that it is very preventable, because type 2 is specifically related to obesity, diet, exercise. So you can control that, right?
Yes.
So first, knowing that. And then the next thing is we need to raise awareness about diabetes and how you get diabetes. And then I think eating habits are very significant. And for us, African Caribbean communities are at highest risk for diabetes just because of our culture, and our foods are tied into culture. I mean, every event, Christmas, coquito, sweet bread, cakes, pies, everything, stuffing, big macaroni and cheese.
Competition.
So I think we really need to be intentional about our eating habits. You can binge every now and again. Everybody cheats.
Right.
But you shouldn't eat like that every single day. And if you go to any local restaurant, you're going to see a very high starch diet. And some people eat like that every single day. And that is the problem. I think we need to raise more awareness around our eating habits. And there should be shame associated with eating like that every single day. It's a problem. So in our nutrition class, our registered dietitian teaches a lot. And I have some of her notes here that I wanted to share, because I remember when I did the presentation for your group, we talked about eating habits. And as I was talking about things like portion sizes and what are considered carbohydrates and why carbohydrates are so important, because carbohydrates tend to turn to sugar, right? So everything from
especially the bad ones,
right,
the processed foods.
Exactly. So your Johnny cakes, and I just wanted to mention some of them so that we'll know when we say starches what we mean. Of course, rice, macaroni and cheese, your roti, your Johnny cakes, even oatmeal. And I love oatmeal. I start my day with oatmeals. Starchy vegetables include everything from pigeon peas to our plantains that we like. I went out to lunch. I was in St. Thomas last week, and I went to lunch with someone, and he ordered, the food already came with 2 plantains, but that wasn't enough. He ordered a separate order of plantains. It must have been, 12 plantains on a plate. I'm just like, how does anybody eat like that? But that's just not healthy, right? So, in terms of fruits, mangoes, we have people that will just get a bucket of mango and just sit and eat the whole thing. But that's sugar, right? So that's really not healthy for you. And everything from your fungi and your kalaloo to confritas. These things, you really have to look at your portion sizes. So we teach a lot about reading food labels, knowing what's a healthy sugar intake. Anything over 5 grams of sugar is really not good for you. And then how to count carbs, teaching about carbohydrate intake. So more nutrition education, I think, is really important.
Yeah. I wanted to go back to some of the stigma that's attached to the disease itself, and how if you're worried about the stigma, you should be more concerned about the prevention, because that's easier and everybody does the exercise, watch what they eat, those kinds of things. But I also wanted to talk about the culture, just to mention, we in the Caribbean, African associated things, we figure herbs can cure everything. So can you, I wanted to mention, really, just go into a little bit of that, because while herbs are good and you need them, they're natural ways of providing your body with nutrients and so forth to fight diseases.
Right.
They are not the cure for diabetes.
They're not. And I think what's very important is, because I did a radio show recently, and the person that was interviewing me, very well-researched individual, and she was giving advice about using natural herbs. But it was related to the fact that, she was a cancer survivor. And so she wanted me to talk more about some recommendations in terms of herbal remedies, etc. And I said, I really think that you have to have the subject matter experts who are naturopathic doctors in on that conversation, because the herbal remedy that works for you and your condition might not work for somebody else that have diabetes. And we have to be so careful with sharing that information. I know when I did my research and I interviewed patients, I had one man show up who brought in some moringa bush, and he swears by it. All I have to do is take my moringa bush, but his diabetes was uncontrolled. So I think it depends on your unique situation, where you are in terms of not only your diabetes, your A1C, but also, do you also have high blood pressure? Are you on medication for something else? Because you have to balance all of that. And our medication management class addresses things like not only traditional medications, the use of marijuana, how all of these drugs work together. I think it's important for people to be informed about this, but you cannot manage diabetes just with naturopathic medicines 100% if you have diabetes. If you have prediabetes, something different, but if you already have diabetes, it becomes difficult.
I know that from just reading about diabetes, you could be very healthy and you could have diabetes and you don't know.
That is correct.
And there are no signs, but I think with the exception of just fatigue, that might be the only thing that you might know. So how often though would you need to get tested if you're concerned about prediabetes or diabetes in general?
So before I answer that, I want to just talk about the signs and symptoms of diabetes. So it includes everything from frequent urination to increased thirst, weight loss without trying, blurred visions, numbness and tingling in your hands or feet, fatigue, very dry skin, or sores that won't heal. Now, in terms of testing, you should be tested for diabetes on an annual basis as part of your annual physical. But if you have a family history of diabetes, your primary care doctor might recommend that you be tested more often. And if you have diabetes, you should be testing your diabetes every 3 months. That's our recommendation. We have a number of patients that come into us. They want medication refills. We hadn't seen them in a year. And we don't refill medications for anyone unless you've had an up-to-date visit, whether it's with us or your primary care doctor. We need to have that on file. But just to share some of the levels with you, a normal A1C test, which is the test for diabetes, is less than 5.7%. You have prediabetes if you're between 5.7 and 6.4%. And then anything over 6.5, you have diabetes. So just so that people will know. And I think we talk about including an annual exam every year, but you really should do that for your children, especially if you see that your child, well, first of all, you have a family history of diabetes, and then your child is overweight. You really should have your child tested. Our youngest patient is 2 years old.
Wow.
So it's really a significant issue, and that's specifically tied to the child being obese. So I would encourage parents to get their children tested, but then you as an adult, you should include your A1C tests along with all your lipid panel as well.
You mentioned earlier that you do some outreach. That includes your mobile van
Yes,
that you
yes.
take out.
Yes.
Is that only on St. Croix or?
Yes. So we do two things. I'm glad you asked that. Our mobile van, we only have a mobile van here on St. Croix.
Okay.
And that is a diabetes mobile health initiative that we launched last year. And so we go into the work sites and into the community screening people. But we do have outreach activities on St. Thomas as well. Like, for example, the childhood diabetes prevention program is territory-wide to even include St. John. And we have an office in St. Thomas, is in the Paragon building, room 208.
Where is the Paragon?
Okay. So you're not a St. Thomas.
No.
So it's right behind of the hospital. I know most people on St. Thomas, they know exactly where it's at because it's, the Paragon Medical Building is right behind of the hospital.
And of course, if anybody wants information, they could contact you. You also have a website.
Yes, we do.
So,
it's vitco.org, www.vitco.org. And then we're on Facebook as well.
And trust me, I visited the website. Tons of information on there.
Yes,
There's no way you should feel any stigma or anything. You on your computer or your phone, and you could get a wealth of information on diabetes.
Yes, we have on our site, we have information about diabetes. It's just an educational piece that you can just click on it and it gives you everything you want to know about diabetes as well.
I want to go back to our initial discussion on prevention.
Okay.
That's one of my things. What do you see in terms of the barriers, whether it's folks that have that stigma attached to it or the access to care, which is important?
Yes, I'm glad you mentioned access to care. I'd like to address that first. Lots of folks don't have transportation, and hence why we have a 6-passenger ADA compliant van that we're rolling out this year. And we will be providing transportation for our patients to come to the center. But we're also rolling that out to provide transportation for anyone who wants to get to their medical appointments. That's one. And then the next barrier that I find for our patients is getting those prior authorizations approved in a timely manner. We see all patients, all payers, Medicare, Medicaid, but for our Medicaid population, the authorization on the meds takes a little while. So, and patients tend to wait until the last minute to get their meds. And so, and even with the private insurances, most of them are requiring a prior auth on a lot of these medication supplies, diabetic supplies and medications, and that takes a little bit of time. So not waiting until the last minute to request those medication refills, that's one piece. And then educating yourself, participating in some of our classes, they're free to the community. So signing up for the medication management class, signing up for the nutrition class so that you can get on track with changing your diet. That's really important to preventing this, changing your diet. See, we really need to eat to live. That's really should be our motto in life, and not just live to eat.
Okay. I wanted to also mention, because sometimes, things are in your DNA, predisposed because your dad had diabetes, your mom or whatever, or family member.
Sure.
Do you encourage people, especially if they're in that group,
Yes, I do. If you have a family history of diabetes, getting tested on a regular basis is important. Changing your eating habit, and I can't stress enough, 30 minutes. I mean, the research shows that 30 minutes, and it's also recommended by the Centers for Disease Control, 30 minutes of physical activity on a daily basis is critical to maintaining overall good health. So I would encourage people to get moving, walking. Some people experience issues with their knees. Find something that you can do to get your exercise in on a daily basis.
Julie, I want to thank you for coming by.
Thank you for having me.
It was really good information. I don't even think we scratched the surface.
So true.
So we may need to revisit that discussion at some point. Your number for your offices in St. Croix, St. Thomas?
Yes, just one number, 340-208-0260. Just wanted to make it easy. And then our website is vitco.org. So give us a call, 340-208-0260.
Thank you. Appreciate you coming by.
Thank you.
And to our listening audience, this has been Ability Radio, actually. And from Disability Rights Center of the Virgin Islands, we are located in St. Croix and St. Thomas, Havenside in St. Thomas, and west of Old Kmart in Frederickstead, St. Croix. Our number is 772-1200. You could get either office on that number. We thank you for sharing day with us.
Thank you so much for having me.
The views expressed on this program are not necessarily those of WTJX, its board, staff, or underwriters.